Asthma controlling medicines like birth control. If you don't take it, you become pregnant. If you don't take the control, you're going to get attacks. What would be the ideal approach to prevent the attacks? And what kind of medications are there available?
There are a lot of different medications that are available. Probably the most effective is a low-dose inhaled corticosteroid. And that's something that helps to decrease the frequency of attacks and the severity of attacks when they do come.
But people hear the word steroid, they get a little bit nervous.
Yeah.
And with inhaled, you don't get all the complications of taking it by mouth. There are some concerns about it, but not quite the same level of taking a prednisone tablet, which is used all the time. In fact, there's an expression, steroid-dependent asthmatic, non-steroid. We don't even use that term anymore. So if you're using controlling medicine, what would be the ones that you would prefer over others?
There are a variety of different types of inhaled corticosteroids, and again, as you said, I like to, these medications are very safely used. They do need to be monitored, and there can be some potential problems if you're on high doses for a long time. One of them is called budesonide. It's a medication that's administered by nebulizer. It's also administered by dry powder inhaler. There are other medications, fluticasone is one of them, beclomethasone, a variety of different inhaled medications.
What would be your approach to a young baby that got a lot of attacks? Any particular one you would go to first?
The budesonide is actually a good choice. It's very easy to administer.
It's known as what, another name?
The trade name is Pulmonary.
Okay, so people have heard the name Pulmonary.
Yes, yes. It's a medication that's actually very easily administered, and there is a pretty good deposition into the lung. There are some practitioners who prefer metered dose inhalers or asthma pumps that also can be effectively used if used correctly in very, very young children.
If we use an example of Pulmicort in a kid who's had frequent attacks, how long would you say you would use that kind of medication?
That medication, as you already mentioned before, is a medication that needs to be used chronically.
And it's not a week, not a month. How long would that be?
It can be several months or even up to a year, depending on how poorly or how well the symptoms are controlled. The way that I decide whether or not somebody needs to be on a medication very frequently is the frequency of the symptoms. I'll give you an example. If there is a child who is having symptoms several days a week, then that's somebody who...
When we say symptoms, what are the things you're looking for?
It could be as simple as a chronic cough.
Daytime, nighttime, which makes you more concerned?
Both, to be honest with you. The nighttime cough is actually very, very frequent in poorly controlled asthma. And if you're having frequent nighttime cough, then that's a little bit more of a concern. Cough with asthma can actually be present both in the day and at night, particularly with certain types of triggers, including frequent activity. But if there are symptoms such as chronic cough or certainly wheezing that are present several days a week, then already you have an indication for chronic therapy with a low-dose inhaled steroid.